When someone you love is struggling, you'll try just about anything to help. And that's really the starting point for what we're going to get into today. We're going to follow along with an investigation by Professor Lin as he takes a really deep dive into a popular brain health supplement. Together, we're going to pull apart its pretty bold claims and try to figure out what's real and what's just marketing. And this is where it all started, with a question that is so incredibly human, right? A reader reached out to Professor Lin wanting to know if the improvements they thought they were seeing in a loved one, could they be real? This one question, it's just full of hope, but also a little bit of skepticism. And that's what sparked this entire investigation. So you look at the marketing for this supplement. It's called Cericum EX, and honestly, it looks super impressive. They're talking about global patents, a bunch of medical publications, and then they hit you with the gold standard, proven in human clinical trials. But are these claims as solid as they sound? Let's dig in and see. Okay. So our first move is to put on our detective hats. We're going to examine the evidence that the marketing department has presented, piece by piece, starting with that really official-sounding claim about global patents. So the first big claim they make is that the product's benefits are certified by patents. I mean, that sounds incredibly official, doesn't it? It kind of suggests that some government body has actually tested it and given it a stamp of approval. But is that really what a patent does? And here we have it, the critical distinction. A patent is basically a legal tool. It's all about protecting the ownership of an idea. The patent office doesn't run tests on the product. They just make sure nobody steals the inventor's concept. So a patent is proof of ownership, not proof of effectiveness. And that, right there, is a massive difference. Okay, so the patent claim is, well, it's misleading. So what about the next piece of evidence? The company says they have over 16 international medical publications backing their product. Now that sounds like a whole lot of scientific research. So Professor Lin went looking for it. So the first logical place to check was the work of the inventor himself. He's an honorary professor from a top-tier university, which sounds great, but here's the thing. His expertise, while it's impressive, is in aquaculture and fish diseases. His lab's own research is about using mushroom extracts to boost the immune systems of farmed fish. And out of his 24 listed papers, not a single one, 0, is about human cognitive function. So we've got a pretty major disconnect here. The marketing strongly implies expertise in human brain health, but the inventor's actual scientific work is in a completely different field. That means the real scientific proof, if it even exists, has got to be somewhere else. So if the inventor didn't do the research, where are these studies? Well, Professor Lin turned to a resource that's available to literally anyone, the PubMed database. It's this huge online library of biomedical research. He kept it really simple. He just used a straightforward search, combining the main active ingredient, which is mushroom glucan, with the benefit they're claiming, cognitive function. This is the most direct way to find the scientific articles that the company says are out there. And that search turned up 5 papers. And this is the absolute core finding of this entire investigation. While yeah, the studies did look at a link between mushroom glucans and cognition, every single one was conducted on mice, not people. Just let that sink in for a second. Which brings us to the most important number of all, 0. That's how many human clinical trials were found that actually support this product's claims. And that is a direct contradiction of the marketing's really bold statement about being proven in human clinical trials. Okay, so this leaves us with a puzzle, right? If the scientific evidence for humans just isn't there, why was the reader's friend so convinced that the supplement was helping her mother? Well, this gets us to the really crucial difference between a personal story and a scientific study. Like, a personal story is incredibly powerful. It's based on observation, on love, on hope. But in science, that's called an anecdote. It's just a single data point without any controls. It's also really susceptible to the placebo effect, where the simple belief that a treatment is working can make you feel like you're seeing improvement. Scientific evidence, on the other hand, is built on these really tough, controlled trials that are specifically designed to rule out the placebo effect and give you actual, verified proof. And this is where Professor Lin's investigation really lands. He doesn't dismiss the friend's experience. He acknowledges it with respect, but he also makes it super clear that in the language of science, this is hearsay, not confirmation. And that's such an important distinction, isn't it? We can respect someone's feelings and their experience without having to accept it as scientific fact.
So we end up kind of where we began, but hopefully with a totally new perspective. That desire to help our loved ones is so powerful, but this whole investigation just shines a huge spotlight on the need for critical thinking. It really leaves us all with a fundamental question. When it comes to our own health journeys, what standard of evidence are we going to demand? A really compelling story or concrete proof?